right, good day. Welcome to another edition of Let's Talk Health. I'm Renee Nash. This program is really designed to talk about critical issues impacting our community, particularly in communities of color. And so today our conversation really is going to focus on memory. We're going to talk about Alzheimer's. And so my guest today is pretty much an expert in that arena. She is Sharon Sellers. She is the Community Department Program Manager for Sibley Memorial Hospital. So thanks so much for joining us for today's conversation.
You're welcome.
How difficult and how critical is this issue when we're talking about memory loss, specifically the issue of Alzheimer's in the Black and Brown community?
Well, first of all, let's look at how important it is and how prevalent it is across our country. I mean, more than 58 million people right now have Alzheimer's disease. Here in the District of Columbia, we have at least 9,000 people that are impacted. These are people that are over the age of 65. This does not take into account that there are also a number of people, what we call young onset dementia. Perhaps 5% of the whole United States, more than 200,000 people are impacted by even early onset. I think what's even more prevalent is that you talk about the 9,000 people here in the district, you talk about 28,000 caregivers. So it's a large community. I think what happens often in the minority community is that diagnosis is not made early enough. It doesn't give minorities an opportunity to really plan their life because diagnosis is often lacking. Why? For so many reasons. Mistrust of the medical system, not having adequate health resources. African Americans actually have Alzheimer's. They contract Alzheimer's disease at twice the rate of white Americans.
And why is that, though? Why is it, and particularly when you just said earlier that the early stages is something that we're not catching?
Well, first of all, there are a lot of risk factors, and there are a lot of risk factors that African Americans have maybe at a larger rate. When we're talking about diabetes, you're talking risk for stroke or heart disease, obesity, not getting enough sleep, being stressed. All of those are risk factors for dementia. Of course, we know Alzheimer's disease is probably one of the most prevalent forms of dementia. But because of all of the risk factors, and if these things are not treated, if high blood pressure is not managed properly, if your cholesterol rate is not managed properly, and we know that unfortunately in African American populations, we often have higher rates of those diseases. If they're not being treated properly, you're going to be increasing your risk for dementia.
Are we hearing that information that you just said? Because I have to be honest with you, that is the very first time I have ever heard of all of these other issues somehow making us at risk for Alzheimer's. Do people know that?
I don't think a lot of people are listening to that information. I think also that there's also a deaf ear to that A word, Alzheimer's. No one wants to face up that it could be me. People, I think, are reluctant to go to the doctors when they think something like that may be going on. I think the other thing is doctors are not, unless you advocate for yourselves, are not going to do a memory screening. It's covered under Medicare.
Now, when should you start doing that, and at what point?
Oh my gosh.
When should you start having a memory test? Because many people may think, it's just information overload. So I forget a little something now and then. Who doesn't forget?
I think you have to figure out what it is. And one of the things in the community that we talk a lot about is forgetfulness. When is it serious enough that you need to get some treatment? And I'll give you a good example. This is an example I talk to my seniors all the time. Forgetful. How many times have you been vacuuming? Remember we had the old bags where you had to replace the bag. Okay, so you're vacuuming upstairs and you have to replace the bag. You go downstairs. Oh, why did I go downstairs? Oh man, you go back upstairs and it dawns upon you that's what it was. You go and get the bag, you finish. That's normal aging, that's okay. But what if you went downstairs to get that vacuum bag, you came back upstairs and you said, who left that vacuum in the middle of the floor? that's something different. Those are the kind of things that we're trying to get people to distinguish, whether it is just, normal aging or whether it is something more serious that you need to focus on.
Now, typically when we're talking about this, is it something that the individual person is going to notice about themselves, or is it something that a loved one will notice about you?
And I think that's a very good point. We are really training all members of the community. We are training members of churches right now to look in look in the congregation right now and notice some things that maybe you yourself might not notice. So I think there needs to be global community training right now of what the warning signs are. The Alzheimer's Association came up with 10 warning signs, but I bet you if you were to ask most people out there, can you name 1, 2, 3 of those warning signs? You probably can't.
Can you name them for us? Can you run off a few of them?
I can go over just a couple of them.
Yeah.
For example, if you lose the ability to manage your finances, I often find out when people are getting the utilities cut off, they're forgetting to pay bills, that is because they're no longer able to process or remember a lot of those simple things. I mean, it's not remembering a name. We all forget names from time to time, but not remembering faces. Classic example, a little old lady in my church drove to church 50 years, same way. She got in the parking lot one day and sat in her car and cried. She no longer remembered, I don't even know how to get home. Not being able to remember directions, things that you have done for all your life, those are significant signs that should send you to a doctor, should have one of your loved ones say, you know what, something is changing. I think we need to look at that.
Is this something, again, that happens at 65? Is it happening? I mean, certainly in Prince George's County, Maryland, the former county executive's wife, who was in her late 40s, early 50s, and was diagnosed with Alzheimer's.
Okay. Your risk for Alzheimer's, of course, increases the older you get. But yes, can people in their 40s and 50s develop dementia? Can they develop Alzheimer's? Absolutely. You have to remember that, number one, Alzheimer's is just one of the dementias, okay? When we talk of the other dementias, it could be Lewy body dementia, Parkinson's dementia, frontal temporal dementia. All of these dementias are caused by different things. You can have a diagnosis called mixed dementia. An African American could have vascular dementia because you've had a stroke. You could also have frontal temporal dementia, and you could have Alzheimer's disease. All of those together. There can be a double whammy because of all of the risk factors that we just talked about before.
You said something very powerful early, and I hear this a lot from health advocates, that you have to be your own health advocate. You do. And the importance of asking your doctor to give you that memory test. At what age should we be making that request?
I mean, honestly, there is no problem when you start getting into your 40s to say, you know what, this is something we need to follow very closely. You want to be able to plan for your entire life. You want to be able to, we don't focus on diagnoses that could impact end-of-life care. And until we're having a lot of those end-of-life conversations, I mean, it's really, a lot of people are afraid to even talk about things like that. But you've got to have those kind of conversations. Having a conversation around the Thanksgiving table about, what do you want to happen? Suppose I lose my memory, or suppose things change. How am I going to live my life, or how should I be treated? We need to be focusing on conversations like that. But more importantly, we need to know what those risk factors are. Are you making certain? I mean, I tell my seniors all the time, do you have diabetes? Do you know what your hemoglobin A1C is? Are you monitoring that? Are you monitoring your medications? What's your blood pressure? What has your doctor said it should be? It's generally being in charge of our health so that we reduce those risk factors that are going to set us up for developing dementia and Alzheimer's disease.
Here at Sibley Memorial Hospital, you have a really unique and powerful program. You call it Club Memory. Tell us a bit about that and what that consists of.
Okay. One of the things, when people develop dementia, there's often a stigma attached to it. people don't want to let other people know that, oh my gosh, I can't remember. Well, we've created an environment. We call it a stigma-free environment. It's like a social club where people can get together that have memory loss and various stages of memory loss. And also their care partners, their caregivers can also get together. So we have a large group of people that are caring for those or partnering with those that are experiencing changes in their memory, as well as those that have various stages of memory. And together we educate, we have fun. It's a social group so that it's no longer looked at that, oh man, he has Alzheimer's disease. That's okay. And we accept that, and we want to walk with people through the journey. If you're diagnosed with Alzheimer's disease, it could be 15, 20 years before you're actually showing major symptoms. The thing with Alzheimer's disease, because there's changes in the brain, these changes could be happening in you or me right now. And until we decide to do a number of things, be in charge of our health, get involved in some of the clinical trials and studies that are going on right now. African Americans, twice the rate of Alzheimer's disease. Latinos, 1.5 times the rate of Alzheimer's disease. Unfortunately, we're not represented in a lot of these studies, whether they're drug studies or other studies that are looking for a solution to Alzheimer's disease. If we're not involved in these studies, they come up with some sort of solution. It may or may not work for us. But there's a stigma, and you know why there's a stigma. It's because historically there's been racism when it has to do with how studies have been done.
Absolutely.
And there's a fear of getting involved. And because of that, we're not benefiting from a lot of the new drugs and treatments that are coming out right now.
How do we turn that around, though? Because I mean, it's been decades, right? And this is an issue, particularly when you're talking about participating in these clinical trials and these studies, that we're just not getting the message, and that fear consistently is there.
You have to get to people where they're comfortable, in the barbershop, in the hair salon, in the churches. Those are a lot of places that we are reaching out right now, because we're finding that in that environment, you are welcoming certain information and it's presented in a certain way. You're going to say, okay, this is okay. This is fine. I can accept this. Yes, now I understand why it's important, why keeping my diabetes under control is important. So you've got to find those comfortable areas. You've got to partner with pastors. We're working with a number of pastors right now to try to reach out to congregations, but you've got to make it such that you're talking the language and it's a comfortable conversation where people are hungry to get information like that.
The key is that this is still very much an issue that's impacting our community.
Yes.
As you said, we're not talking about it. We're not participating in the clinical trials. We're not getting the treatment in a quick, fast way to deal with early stages. But Alzheimer's still remains that issue that we don't necessarily know what causes it, right? Or do we, can we say for sure, 1, 2, 3, if you do this, you're going to get Alzheimer's, and 1, 2, 3, if you do that, you won't get it. 1, 2, 3, here's the treatment.
Okay. Alzheimer's is still of the 6 leading causes of death. Alzheimer's is the only one for which there is no cure right now. Okay, so no, we don't know why you get it. We pretty much know that there are certain risk factors, and we have now the research that says if you monitor, there are modifiable risk factors that you can reduce your risk significantly, or maybe you can slow down the progress of Alzheimer's disease until we can come up with a cure. So the best thing that we can do right now, I mean, are you walking, 5 miles a day? That's an exaggeration. But what they're saying, American Heart Association says 10,000 steps a day is the minimum of what we should be doing. Are you exercising 2.5 hours a week? Are you modifying your intake of certain foods so that you're now getting that nutrition that's going to be feeding your brain? Are you exercising your brain on a daily basis? Have you learned something new today? So these are a lot of the things that we're trying to get the message across of what you can do differently to kind of maybe keep things in check right now.
Where can people go for more information? And I want to talk real quickly before you answer that final question about caregivers, because
Sure.
again, so many people are impacted. We are living longer, which again, as you said, increases our risk factors. Talk about the caregivers and what's available out there for them,
Right.
because this can be a long road.
It's absolutely a very, very long road. Sibley is fortunate that we have a number of support groups, and we're reaching out to a large number of people here in the community. But as I mentioned before, there are 28,000 caregivers here in the District of Columbia alone, and that number continues to grow. With all the support groups that even Sibley has, or that the Alzheimer's Association has, and other groups have, we're only tapping a very small part. We need more funding in order to have more resources for caregivers. This is a very, very expensive disease.
Yeah, I was going to say that.
Oh, yeah.
What makes it so expensive is the medicines or the fact that many times as children of parents, we have to hire caregivers and the like.
The cost of the care is very, very expensive. I think the other thing is we find that many people are not resourced enough to put your loved one into a facility, and that's not for everyone. A lot of us want to provide the care for someone at home. So what does that mean? If you work, if I work, that means we have to bring someone in to care for mom or dad, to keep them safe, to keep them from wandering away, to keep them, engaged and occupied. All of that is very, very expensive. Alzheimer's disease, as it progresses, you most likely are going to have 24-hour around-the-clock care. That's very expensive, and most of us, many people in the District of Columbia, just don't have the resources to do that. So you find that caregivers are burning themselves out as well, working around the clock, working and trying to care for loved ones. I think DC is realizing that more resources, more cost-effective resources. I mean, you can say that, yes, I know that my loved one needs to have, home health care. But home health care, if you're not getting it paid for by Medicaid and it's coming out of your pocket, and my gosh, I mean, do you know what that costs?
I do.
Okay, then realize, I mean, we're talking, anywhere from $17 to $25 an hour to have someone come take care of your loved one. Most of us can't afford something like that on an ongoing basis. But we're providing as much support as we can. It's support and education for caregivers. We surround them with what we call dementia navigators who help navigate them through all the resources here in the District of Columbia so we can piece together a program that works for each family, and each family is so different.
I think that's so important. Tell people where they can go and find that information that you're talking about, particularly the resources. The resources are critical.
Well, as you mentioned earlier, Sibley Memorial Hospital's Club Memory Program is a program that right now reaches close to 1,000 people right now in terms of the care that we're providing out in the community, the presentations that we're making, as well as the ongoing care of people that are in our Club Memory Program. More than 700 people on a monthly basis are being touched by the Club Memory Program. If you look at the Care Partner support groups, I mean, we're touching an additional, 200, 300 people through that. So Sibley Memorial Hospital is definitely a resource. Our Club Memory Program is one of giving education and providing that respite, providing that support, providing that hope that yes, you can do this and that we're here to stand with you.
All right. Thank you so much for the conversation.
You are so welcome.
Is there anything else that you wanted to add before we wrap up?
I think the only other thing that I want to add is that we need to remove the stigma. As we're removing the stigma for mental health, we need to remove it for Alzheimer's disease and all of the other dementias that are out there. These are brain diseases, and until there's a cure, we have to be sympathetic, empathetic, working with families, and understand it's a struggle. Understand that caring for someone with Alzheimer's disease is probably one of the most difficult things you'll ever do.
Yeah, and it takes a great deal of patience.
It's patience. It takes a caring heart.
Yeah.
And that's what we are hoping to support, those that have a caring heart, that are standing by their loved ones for this journey with Alzheimer's disease.
All right. Sharon Sellers, Senior Community Dementia Program Manager for Sibley Memorial Hospital. Thank you again so much for joining us for Let's Talk Health.
Thank you.
Once again, I'm Renee Nash. Again, and make sure you check us out each and every week for Let's Talk Health. We are here to provide engaging and powerful conversations to help you live your best life, and you can only do that if you're healthy. Be well.